Okay, we're talking lubes.
We're talking lubes first.
Lubes first.
So a lot of patients ask us a lot of questions about lubricants.
Yes.
And I would say misconception number one is they don't realize that different lubricants are made from different materials.
Yes. So I think what we like to talk about is water-based lubricant
And a silicone-based lubricant.
silicone-based lubricant. There are organics and there are oils, but we're going to stick to water and silicone for this video. So water-based, I find all my patients want to use water-based because water sounds natural. You're like, oh, right, I want to use water. But people forget that water is a universal solvent, which means that you can mix lots and lots and lots of things in with water-based lubricant. And the problem with that is that until recently, there was very little discussion about what that meant for vaginal mucosa. So what we really want to pay attention to in a water-based lubricant is the pH. So that's like the acid-base measure. And the osmolality, which Eryn always says is like how salty something is, or like how much particles of other things you can mix into a water-based product.
And the other thing is that water-based alone, if you're starting with a dry tissue, obviously it's going to want to absorb the water. But then, as Katie just said, with osmolality or how salty a product is, that can increase that more or less depending on how salty it is.
So the World Health Organization actually tracks this information because when you have a lubricant that you're using, particularly a water-based lubricant, but a lubricant that you're using that is not pH matched to vaginal area and not osmolality matched to vaginal area, you can see an increased risk of fissures. So little vaginal like fissures, like
Paper
microtears,
cuts.
like little paper cuts,
Yeah.
right? Which is uncomfortable, but it also means that you're at a higher risk of then getting some sort of an infection, be it a yeast infection, urinary tract infection, or sexually transmitted infection. As long as those bacteria are present, if there is a cut or a fissure, then that's like an open door for that.
It's like a break in the barrier.
Yeah, it's a break in the barrier. And so that's why the WHO is tracking this. Now, what we can find is if you use a silicone-based product, it doesn't have, it's not a water-based product, so it doesn't have a pH, it doesn't have an osmolality, right?
Which is great because if it's dry tissue, then you don't have to worry about the thirsty tissue wanting to absorb more water. It'll like stay on the tissue better.
It's like trying to moisturize your hands with water, especially if they're already dry.
Patients ask me this, that's why I'm flipping this over.
Yeah.
So the ingredients that you should be looking for when you flip over a silicone-based lubricant is dimethicone, and I'm going to never say this one right.
Yeah.
Dimethiconol.
I usually say if dimethicone is in it, that's what you're looking for. It's like a medical grade silicone. Silicone lubricants are condom safe as well. And so there's some confusion about that, but you can use silicone with condom and you go ahead.
I was just going to say silicone doesn't go with silicone.
Right. So you want to be careful if you're using silicone lubricant on top of another silicone product, be it like a silicone sex toy or a silicone vaginal dilator or any other silicone medical device, because they are very difficult to clean and you can wear away the service when silicone rubs against silicone. So if anyone has pain or discomfort, our go-to is often use a silicone-based lubricant. And so this is like my number one recommendation is to use a silicone lube if you're postpartum, because we know that that's a low estrogen state and there tends to be dryness.
Or dryness,
yeah. Or if you are postmenopausal or having menopause-related dryness. And if someone just has a genital pain condition, so if you've got vestibulodynia, any sort of hypersensitivity in the genitals and that. So what else do we want to say? Oh, I know what I want to say. Lubricant goes on you where you feel the dryness and all down the length of whatever object is being inserted, whatever that might be. Like both parts need to be lubricated.
I was just going to joke and say silicone is very slippery.
Yeah.
So if you spill it or you have sheets that you don't want to leave residue on, start with less and then kind of add as needed.
Oh, that's the opposite advice that I give because I'm working with pain patients and I'm like, you know what? Put extra on. If you fall off, just be careful.
I think all I need is the first time. Get a feel for like how slippery it is.
But you do make a valid argument. It does feel, silicone feels like an oil. It's not an oil. Oils are not condom safe, but silicone will feel different than your water-based gels. It feels like an oil.
So I think like I'm just like test drive what it feels like first. And then I'm like, you probably need more than
Yes. Right. Just 5 minutes. Water-based versus silicone-based.
Ask us if you have other questions, like DM us if you don't want to post it under the video, or email us. Info@reconnect.ca.
Ciao.